Hi everyone, we're delighted to be here today and we're really enjoying listening to your presentations and initiatives. So my name's Sarah and I'm joined today by my colleague Melissa. So we work as Admiral Nurses and we're going to tell you a little bit more today about how we've set up the Admiral Nurse service at Leicester hospitals. Also, we'll be referring to it as UHL and how this supports personalised care for people living with dementia and their families. Next slide, please. So just to give a little bit of context and background, we are a large teaching hospital serving a population of over 1 million people. We're based over 3 main hospital sites and we employ approximately 16,000 staff. So we have over 13,000 people living with dementia in this locality, and this is expected to rise a lot following the pandemic. In the last 11 years, UHL has seen a 175% increase in the number of discharges from hospital for people living with dementia. And the Admiral Nurse service was introduced into the Trust in 2019 to try and increase the care and experience of care for people living with dementia and their families when they're admitted to the hospital. We recognise that this patient group are particularly vulnerable when coming into this environment. Next slide, please. So what is an Admiral Nurse? We are dementia specialist nurses and we're supported and developed by Dementia UK. The team here at the hospital are 1.8 whole-time equivalents, and we are, as I said, we implemented this service in 2019 to provide clinical support to people living with dementia and their families. Initially, an extensive scoping exercise was undertaken, and it was clear that data was going to be really important to evidence the impact of our service. We developed a referral criteria and we trialled the service in several different areas of the hospital, attending daily board rounds and promoting awareness of the role. We provide individualised holistic assessments for each patient that we see, which leads to a personalised plan of care and interventions for them. This is reflected in the Admiral Nurse intervention tool that we have developed. It includes areas such as advocacy, early discharge and advanced care planning whilst in this clinical setting. The service is adapted during the pandemic to provide alternative support to families as they were unable to be close with their loved ones. Patients and families are then supported throughout their admission and followed up by telephone on discharge, with referral on to appropriate community services if needed. This might also include work around admission avoidance. We're fortunate to have small pockets of Admiral Nurses in our locality that work in the community. We also developed a postal and online experience of care survey, which is sent to families around the time of their discharge from the service. A large part of our role includes supporting best practice and acting as role models. This is to promote person-centred and relationship-centred approaches to care. A large part of our role is also around staff training and development, such as our older people and dementia champions in the Trust. I'm going to hand over to Melissa now. If we could have the next slide, please.
So it's very hard to quantify what an Admiral Nurse does, and we have chosen to present to you with a case study of a lady who the service supported. A family shared their story at the Trust Board meeting. So this lady was living with Alzheimer's dementia and had primary progressive aphasia, causing her speech and language to be affected. She had extreme difficulties in expressing her needs, and she had periods of frequent admissions over an 18-month period. So you can see on this slide some of the key interventions the Admiral Nurses supported her and her family with, such as advocacy for her and her family, pain assessment. Because she was unable to communicate her needs, we supported by using the pain aid assessment. We supported with the meaningful activities team. She became very distressed and suffered with anxiety and was due to go for a CT scan. The meaningful activities were able to support her with this. We also supported with a nutritional plan for her. This lady liked to walk with purpose and would often not sit down for meals. So we suggested things like finger foods and milky drinks to help support with this. There were also safeguarding concerns. and that was a very sensitive nature for her family, and we provided them with emotional support, but also supported the discharge team. During one of her admissions, she became end of life, and we were able to support the family with this, enable them to come into hospital to come and see her and be with her. Following this, we provided bereavement support. We sent out a card to the family, which we've had designed with a forget-me-not heart, and also seeds for them to plant to remember her. We'd now like to read out some of the feedback given by her family. In mine and my sister's opinion, this team are absolutely brilliant. They were the first people that we asked for help with our mother back in 2019. Melissa, one of the team, took the time to get to know my mother, to really understand her and the best ways to communicate with her. She then shared this with the team who were caring for my mother, and this included the medical team responsible for her care. When my mother saw Melissa, her face lit up as they'd built up such a great relationship. Due to COVID-19, we were unable to visit our mother, but Melissa was able to give us updates of what was going on with her, which we found reassuring. Mum had to have a catheter, which she really didn't like, but Melissa took the time to reassure her and comfort her. It was like she was representing my sister and me, as we were not able to offer our support to Mum. Mum was a very active and would walk around the ward, which Melissa supported her in doing. In December 2019, Mum was admitted to hospital again. We contacted the Admiral Nurse team to find out what was happening with her. Mum had primary progressive aphasia, which meant she was not able to communicate with us. Melissa was able to ensure that we were aware of what was happening. When Mum's condition deteriorated, Sarah, the other Admiral Nurse, advised that now was the time to start coming to hospital to see Mum. She arranged for this to happen and met us on the ward to offer us support, to check we were okay. They even brought us gifts to support us as we were staying overnight to be with Mum, and this was so kind. Mum sadly passed away on the 19th of December 2020. My sister and I were able to be with her, to offer her support and comfort. The Admiral nurses continued to offer their support even after she passed away, contacting us by telephone to check that we were okay. I do not know where we would be without the Admiral nurses. They were our eyes, our ears and voice. We felt very comfortable leaving Mum with them.
Can we just go back to the previous slide? I think we've gone ahead a little bit. Okay. Oh yeah. Thank you.
So the Admiral Nurse service continues to expand its reach with exciting QR projects taking place to improve for this patient group. For example, the MDT delirium bundle that we've worked alongside the ortho-geriatricians on, currently at the piloting stage, and we are aiming to roll this out trust-wide. We've had the opportunity to share our work locally and nationally, and to see the potential for the future may hold working with our local Admiral Nurse services. We have also recently set up a weekly dementia MDT to discuss complex clinical cases. We've been working hard to develop our champions network, and by doing this, empowering our workforce to provide person-centred care. Next slide, please. We would like to thank you for listening today. It is almost unimaginable to think how difficult it has been for people living with dementia and their families when admitted to hospital during the pandemic, and we are proud and honoured to have been here as Admiral nurses to support them at this difficult time. We would like to leave you with some of the positive feedback we've received from families we have supported. And if you have any questions.
Thank you.